Alcohol is estimated to be responsible for more than 33,000 deaths every year. More than a third of men and 1 in 5 women drink more than the advisable weekly limit every week. The personal, social and economic costs of alcohol are huge. Frontline services coming into contact with the general public on a day-to-day basis are in a unique position to influence. CHAMP's Public Health Network, working with partners, has delivered an Intervention and Brief Advice, or IBA, training programme to help frontline staff talk to people about alcohol.
The whole idea of brief advice and brief interventions is being able to talk to somebody when they're at that point when they know that they want to change their habits. And for this occasion, it's about thinking about their drinking habits and making a change to those drinking habits. The planning took place through the Public Health Network, through CHAMP's Public Health Network, and a range of partners were involved in the planning, the police service and the fire service, together with public health from the NHS. What happened was that we developed a training programme about how to ask questions when people are expressing a desire to change behaviour. So we developed a training programme for staff from partners, and we then delivered that training across the partnership, so that we had 100 people across Cheshire and Merseyside trained to be able to deliver brief advice and interventions. That is, when they met somebody who wanted to change their lifestyle, they were able to have that conversation with them in a supportive way and signpost them to appropriate services.
Cheshire Fire and Rescue Service were just one of the partners involved.
When we were offered to take part in the IBA, we've seen this as an opportunity to target sort of trend that we see now and again in the community, which is fires which are related to possible contributing factor of being alcohol. Well, all of our community safety teams have undergone this training. Initially, our team leaders underwent the training with CHAMPs, and then that was cascaded to our delivery teams. We've communicated this intervention to all our firefighters, who now have the awareness and the understanding that if they do attend incidents, that they signpost our community safety team, who then go out and offer this advice.
Cheshire East Leisure Services team also took part.
Well, at the place I work at All Stages Leisure Centre, we deal with GP referral cases. People have been sent by the doctor for various medical conditions. Could be high blood pressure, cardiovascular problems. And I felt that this would be a really useful angle. It'd be something else that I can offer people. And a great many kind of conditions such as high blood pressure are linked with alcohol consumption anyway. Also things like obesity, so the list is endless, and I felt that it would be something that was really appropriate to what we do anyway. As a health and fitness advisor, I'm in probably one of the best positions possible to pass this information on. I'm in a position of trust. When people come to me initially, they fill out a health questionnaire, and there are various lifestyle questions about medical conditions, about their drinking habits, about all sorts of things. So I get to look at that first, and then I'm in a position to be able to discuss each of those points with them. That's a really good time that I can start to gradually introduce some of this information where it's appropriate.
Giving brief advice in a social setting can have many benefits.
So far, it's been really useful to be able to, help as many people as possible, really. I mean, the more people we can help, the better. It's good for us, it's good for them. They can get advice in a cosier atmosphere, rather than going and seeing some clinician or some official behind a desk. They can see someone that they've grown to trust as a bit of a friend, really.
So how successful has the training been so far?
The results so far are obviously we've got 100 people trained across Cheshire and Merseyside who can deliver brief advice. I think our next steps is to understand how many people they're getting in contact with, and therefore we can then really build a pyramid of advice across Cheshire and Merseyside. I believe that this intervention was successful because we were able to work across a wide range of partners, and we were really able to put the evidence into practice, because the evidence base says that 1 in 8 people will change their behaviour if you have a conversation at the right time. And by introducing this training package across Cheshire and Merseyside, I think we've skilled up over 100 frontline staff to be able to have the right conversation at the right time for the individual. My top tips for successful public health initiatives are very much know your evidence base for the intervention you want to introduce, make sure that you've got the support of your partners and be able to respond to their agenda.
So we've seen how effective IBAs can be in changing behaviour like excessive drinking. By working with partners who are on the front line, we can reduce the levels of alcohol harm and make every contact count.